So this has just been a nightmare from September 7th, 2017 until now.
A 20-year veteran who has seen his share of pain now lives with a daily reminder. It is another medical device danger story that changed this Marine's life forever.
I did tours in Guantanamo Bay, in the Gulf War in 1991, 3 tours in Okinawa.
David Winnett has seen a lot.
Went to Egypt on an operation.
20 years in the Marines took him around the world, but the training took its toll.
I developed degenerative discs, and I started experiencing a lot of back pain during the last 2 to 3 years of my career.
For years, pain pills helped. Then doctors pushed David to consider an alternative, a spinal cord stimulator.
What they told me was that I could relieve the back pain and get off of the opiates.
Stimulators use electrical currents to block pain signals before they reach the brain. 50,000 are implanted worldwide each year. He scheduled surgery for September 2017, a 1-week trial to see if he should get the permanent implant.
So I came out into recovery, I woke up, and within about a minute of waking up, I felt a very intense pain in my left groin, an intense pain. And then the pain hit my back, and it was like somebody stabbing me in the spine. It was just horrible. I started screaming.
Doctors flew David to Austin for emergency surgery, removing the stimulator first.
And oh my God, I thought the pain at the clinic was bad in my groin and my back. This was like 1,000 times worse. Well, the next day, after I woke up and I'm in ICU, the doctor who had put the device in came to visit me, and he was apologizing and so forth. And I said, hey, doc, you know, that pain when they took that thing out was horrendous. And he said, didn't they turn it off? Why didn't he turn it off? Why didn't the company rep have the presence of mind to turn it off? Look at that, look at that. The lights are blinking.
He took this video while recovering in the hospital.
And it literally felt like I had sparks inside my spine. It was that bad. An MRI taken right after they pulled him out in Austin showed that one of the leads had taken a wrong turn. It hadn't gone straight in.
Doctors determined the stimulator hit a blood vessel, causing blood to fill his spinal column, killing the nerves of his spine. The life-changing surgery changed him in ways he never imagined.
That's what paralyzed me. And it looks to be, unless there's a miracle cure for my paraplegia, it looks to be a lifetime sentence. And I did not plan to spend my retirement this way, you know. I have to deal with the hand I'm dealt, you know.
David is not alone. Device Events found 681 people have been paralyzed by spinal cord stimulators and more than 100,000 other injuries, most since 2008.
There are many heartbreaking stories, including David's.
Attorney Dan Ross has represented a number of patients with spinal cord stimulator issues.
Companies have been successful in getting judges to throw out these cases because they're preempted by a law that doesn't offer any remedies.
The device David had implanted was approved a month before his surgery through the pre-market approval process, meaning it did undergo some human clinical trials. But because of that, he can't sue the manufacturer for what happened, a loophole Congressman Lloyd Doggett and others want to fix with the Medical Device Safety Act.
It's important that doctors get this information in and that we have the right, everyone has the right to seek redress for their injury, and that these companies don't hide behind the FDA.
It is too late for David.
Ironically, even after my paraplegia, I still have the same back pain because I'm paralyzed below that level.
He makes the best of each day, sharing his story in hopes of helping others know the risks.
I tried to do the right thing. I tried to do what's politically correct nowadays to get off the opiates. Well, look what happened to me as a result. If I had it to do over, I would have slept in that day.
What a story. Well, a group of doctors and medical professionals studied spinal cord stimulator surgeries and found about 1/3 of patients experience complications from the surgery, most of them minor. Now, they go on to say severe complications, including paralysis, happens in less than 1% of cases. This is one of